So let us start another chapter, number 12, histamine antagonist. This is very important for clinical point of view. So therefore we have to start the histamine antagonist. In the previous class that we have already recorded a video in which we already discussed about the physiology of histamine, or you can say physiopathology of histamine. Even though in this class we are going to discuss few of the point about the histamine, so it will make easy to understand the role of histamine antagonist. So let us start with the where it released and where it found. I mean histamine, where it found and where it released. So within the body, where the mast cell is present, where the basophil is present, you will find the histamine. And the places like skin, lungs, gastric mucosa, and in the same gastric mucosa, all we have to tell the ECL cell, the enterochromaffin-like cells. That is nothing, that is the neuroendocrine gland which found in the gastric gland and participating in the HCl production through histamine. Means HCl production routed through the pathway histamine after its attachment to the receptor. Now we are going to discuss about the stimulus which give rise the stimuli to release the histamine. So the stimulus which give rise to release the histamine are antigen antibody reaction like type 1 hypersensitivity, or you can call it immediate type of hypersensitivity, particularly associated with antigen, and in the antibody particularly IgE is concerned. So there you will find the release of the histamine, and therefore this is going to give rise the allergic reaction. The second stimulus, tissue injury. If any injury occur over the body like skin, then the mast cell is going to release the histamine, and therefore you will find the physiopathological function of the histamine as a symptom. Other stimulants like drugs and foreign chemicals that are also going to give rise the histamine release, means कि venom may stimulate to release histamine, antibiotic may stimulate to release the histamine, dyes and alkaloid like morphine, these are the chemicals, things, substance that induce the stimulate to release the histamine. And in the same previous class, we already discussed histamine is going to produce physiopathological function or physiological function, particularly through the four receptor, and the receptors are H1 receptor, H2 receptor, H3 receptor, and H4 receptor. These H are indicating histamine first letter H. In the same class, we already discussed when histamine is going to attach with the H1 receptor, they are actually G protein coupled receptor in which GQ11 protein get activated, and consequently GQ activation give rise to finally second messenger like DAG, and IP3, inositol triphosphate. DAG and inositol triphosphate. And this inositol triphosphate is going to give rise the intracellular calcium level. So finally, through the IP3 pathway, by activation of H1 receptor through histamine, activation of GQ, therefore they are going to give rise to DAG and IP3, and IP3 is going to produce the calcium, and this calcium is intracellularly raised, and if this is a smooth muscle, then this is going to produce the contraction through calcium calmodulin reaction. Therefore, it produces the contraction of the smooth muscle. Like smooth muscle in the bronchiole or in the lungs, it produces the bronchoconstriction. So, as we know, in case of asthma, bronchoconstriction is occurring. So, when we are going to block this pathway by using the antihistaminic, we may say that the utility of antihistaminic in asthma for the treatment, but to some extent. But the condition of this histamine is to directly act on the smooth muscle. However, when you are going to consider the same pathway through the on the blood vessel, they are going to produce just opposite action, that is the relaxation and vasodilation. How the same histamine through the same H1 receptor is going to produce two different functions at two places. This is very, very interesting and important. So the explanation and the reason behind this is that when we are talking about the vascular smooth muscle, they are not directly acting over the vascular smooth muscle. It is rather indirectly acted in majority of blood vessel. Means कि histamine is going to attach with the H1 receptor on the present on the endothelial cell, and in the endothelial cell of the blood vessel, the calcium get raised in the endothelial cell, not in the smooth muscle. So this is very, very important. And in endothelial cell of the blood vessel, there they are going to release the nitric oxide. This nitric oxide, once it get released, this now going to act on the nearby vascular smooth muscle to produce the relaxation through production of cyclic GMP. Through cyclic GMP, this is going to produce the relaxation, and therefore it give rise to vasodilation. That means in vascular smooth muscle, in majority of blood vessel, histamine produces vasodilation indirectly, first acting on the endothelial cell to release the nitric oxide, and the released nitric oxide is going to act on the vascular smooth muscle, and therefore it give rise to vasodilation. So this is very, very interesting and important that I already explained everything. Now we have to go through the histamine, what histamine is going to produce, what are the physiopathological symptoms that histamine is going to produce. Histamine is going to produce on the skin itching when histamine is released on the skin. If this is histamine is going to release on the blood vessel, this is going to produce vasodilation, as well as because of the vasodilation, the plasma or the content present in the blood is coming out, and therefore in the surrounding, because of the vasodilation, it produces edema. So this is another important point. When the histamine is going to act on the respiratory smooth muscle, that we are going to already explain through the same GQ activation through H1 receptor, going to produce the contraction by rising intracellular calcium level and act directly. So this is very, very important. And in the brain, when histamine is releasing, responsible for wakefulness. So therefore, when we are going to use antagonist, they are going to produce the sedation, and as well as it give rise to appetite suppression. So when we are going to use antihistaminic, they are going to produce or inhibit this action. Now we have, so this is all about the physiopathological or physiological function concerned to the H1 receptor mediated through GPCR, particularly the GQ protein. The same histamine, when it is going to attach with the histamine 2 receptor, they activate another GPCR and particularly the GS protein. And because of the activation of GS protein, when histamine is attaching with the H2 receptor, histamine 2 receptor, present on the parietal cell, basolateral membrane of parietal cell, then what will happen when the histamine is going to attach with the H2 receptor present on the basolateral membrane of the parietal cell, and therefore it get activated. So once this histamine 2 receptor get activated, what will happen? This H2 receptor is through the protein GS is also activated, and once GS protein get activated, it stimulate or activate a enzyme, we call it adenyl cyclase. So adenyl cyclase enzyme get activated because of the activation of GS protein, and this adenyl cyclase is going to convert the ATP into cyclic AMP. So this cyclic MP level get raised in intracellularly, I mean in the parietal cell, and this intracellular cyclic MP raised level in the parietal cell is going to have the positive effect on the proton pump. This cyclic MP, high concentration of cyclic MP is possessing the positive effect, or you can say rather it is inducing the proton pump. So what is the meaning of proton pump? Proton pump is nothing. This is an enzyme. We call it hydrogen ion, potassium ion, ATPase enzyme. So this proton pump, or you can say hydrogen ion, potassium ion, ATPase enzyme, and because of the activation of this enzyme with the cyclic AMP, what this is going to do, this pump is when activated, it is going to take out the intracellular hydrogen ion to outside. So our hydrogen ion is going to move out, and potassium ion is going to move inside from outside. So this is the function of this enzyme or proton pump: hydrogen ion, potassium ion, ATPase. So once because of the high level of the cyclic MP possessing positive effect on the proton pump, hydrogen ion is going to release, and this hydrogen ion is going to combine with the chlorine to form the hydrochloric acid. Therefore, hydrochloric acid get formed. So when we are using any blocker, any antagonist, that blocking this attachment of histamine to act over the H2 receptor, that is also blocking the HCl release. So therefore it is to be used, I mean histamine receptor H2 receptor antagonist or blocker, mm, to be used as a antacid, or it may be used to treat the peptic ulcer. So this is very, very important. However, the next receptor are histamine 3, histamine 4 receptor. Their action is rather mediated from with the another GPCR protein, that is the GIO protein, and that possessing just opposite to the action of GS. Means in GS activation there is raised cyclic MP level, whereas in H3 and H4 receptor activation by the histamine is going to decrease the cyclic MP level, because it inhibit the activation of inhibit the activation, therefore cyclic MP level not get raised. Now we have to go through the therapeutic use of histamine receptor antagonist. First, we have to start with the H1 receptor blocker or H1 receptor antagonist, or this is also called H1 receptor inverse agonist, or this is also called as antihistamine. So all the name is telling only one thing: when histamine is going to attach with the H1 receptor, then therefore this is going to produce the several physiological function. So when we are using any antagonist of the H1 receptor, then what will happen? This attachment of histamine to its receptor is going to be blocked. Why? Because antihistaminic or H1 receptor blocker or H1 receptor antagonist or H1 receptor inverse agonist is going to bind with the H1 receptor in place of histamine, and therefore histamine not get the position to acquire H1 receptor, therefore it will inhibit the histamine physiopathological function. Regarding the history of antihistamine is concerned, antihistaminic activity was first demonstrated by the scientists Bovet and Stubb in the year 1937. So this is very, very important. Now we have to go through the H1 receptor blocker or antagonist classification. So H1 receptor blocker or antagonist or inverse agonist get classified into two type: the first generation and the second generation. So now we have to go through the first generation H1 receptor blocker or H1 receptor agent. So what is very, very interesting important point with the H1 receptor blocker under the first generation is that they are lipophilic. Because of the lipophilic nature of the drug under the first generation H1 receptor blocker, they crosses the blood-brain barrier. So once these blocker reached in the brain, they are going to produce the sedation. Why this is going to produce the sedation? Because we earlier discussed that histamine is going to produce the wakefulness. So when we are going to check the wakefulness, then automatically this is going to produce the sedation. So this is going to produce the sedation. In addition to that, the important features of H1 receptor blocker and agent are that in addition to the activity of the H1 receptor blocker as a H1 receptor blocking action, it also block other receptors like cholinergic receptor blocking, like alpha adrenergic receptor blocking action, like serotonin receptor blocking, or you can say the 5-HT receptor blocking action. So these are the additional activity. Why we are calling it the additional effect? Because these effect we don't ask. What we want only those effect that of our interest. So our interest for only blocker of H1 receptor. So we are only talking about that. But if the drug is going to produce in addition to that effect, I mean H1 receptor blocking effect, that additional effect is act as a side effect. So when the drug that block cholinergic receptor in addition to the H1 receptor blocking activity, they are going to produce side effect like dryness of the mouth and the urine retention. So these are the very important side effect associated with the cholinergic receptor blockers. Under this, the drug are coming that are very very important are chlorpheniramine maleate, then brompheniramine maleate, and clemastine. Chlorpheniramine maleate, and earlier we are using pheniramine maleate. Pheniramine maleate is coming in the trade name of Avil, that we all aware about the about the Avil, that Avil is a antihistaminic drug and used against the allergy, as well as this is going to inhibit the side effect of the drug that induces by release of histamine. So this is very very important drug. And this chlorpheniramine maleate belongs to chemical group, we call it alkyl amines, and this is the, you can say, the first drug under this alkyl amine was the chlorpheniramine, so we are calling it the prototype drug in this group. Other than that, the drug are brompheniramine, that belongs to group alkyl amine, and the last one is clemastine, is ethanol amine group, belongs to ethanol amine group. And there are side effect are dryness of the mouth as well as the retention of the urine. So this is all about the drug which having the cholinergic blocking action. Other drug that are again from the first generation H1 receptor blocker, and rather it poses additional activity by blocking alpha adrenergic receptor, and because it is blocking the alpha adrenergic receptor, the effect will appear that we call it the side effect are hypotension, that means this is going to lower down the blood pressure, and as well as it increases the heartbeat, that we are calling it the tachycardia. So under this, that in addition to blocking H1 receptor, the drug is going to also block alpha adrenergic receptor are diphenhydramine, doxylamine, and cyproheptadine. So these three important drugs are having additional activity on blocking of the alpha adrenergic receptor, and the example that I have mentioned in these, diphenhydramine is ethanolamine group belongs to, and also prototype of this group ethanol amines, diphenhydramine. This diphenhydramine and doxylamine both are used for the therapy of sleeplessness. When a patient is not sleeping well, they lacks sleeping. So this is called sleeplessness, or in terminology insomnia. So for the treatment of insomnia, we are using the drug diphenhydramine and doxylamine. So it will inhibit the sleeplessness. So therefore it is used for the therapy of insomnia. Now we have to go through the H1 receptor antagonist, H1 receptor blocker, that also block the 5-HT receptor, serotonin receptor, and therefore they produces the effect as a side effect are it increases the appetite. So under this, there are three very interesting important drugs are coming which are having very good therapeutic efficacy, like cyclizine, meclizine, and promethazine. The cyclizine and meclizine belongs to piperazine groups, and promethazine belongs to phenothiazine groups and is also a prototype drug in the group. So promethazine as well as the meclizine having very much therapeutic utility in the vomission for the therapy of vomission or emesis, particularly caused by motion sickness. So we are going to treat the vomission or as a antiemetic drug. The emesis will produce because of the motion in the patient, means when a patient is moving or traveling on the vehicle, they are going through the vomission, and therefore for the treatment of that we are going to use the drug like meclizine and promethazine. This promethazine is coming in the name of the trade name Phenargan. So Phenargan, that we all aware about, this is very much usable drug as an anti-allergic drug, also antiemetic drug, that antiemetic particularly of the motion sickness. So this is very important point regarding the therapeutic utility of the. So this is all about the drug that are coming under the first generation H1 receptor antagonist. Now we have to go through the second generation H1 receptor blocker or agent, and that are very important, and also having some silent feature that is having more better than the first generation H1 receptor antagonist. So under the second generation H1 receptor blocker or agent, the interesting point, that is very interesting point, is that the drug is not going to cross the blood brain barrier, and therefore no sedation. So no side effect of the sedation. You can't feel sedation after taking the drug that belongs to the second generation H1 receptor blockers or antagonists. Under this, we have kept in three classes, number A, B, C. So in this, the drug are cetirizine, desloratadine, and fexofenadine. Regarding the cetirizine, desloratadine, and the fexofenadine is concerned, the desloratadine and fexofenadine, they belongs to the same group, piperidines, whereas cetirizine is belongs to piperazine, and cetirizine is one of the most usable drug as a anti-allergic drug, used as a anti-allergic drug, very much usable in cough, in urticaria, in many allergic reactions. This is very much usable drug. Regarding terfenadine is concerned, so what is this terfenadine? Is a prodrug. So this is very important. Is a prodrug, that means the drug is inactive and get in inactive drug converted into active form after its metabolism by the liver enzyme, and it will converted into fexofenadine. So fexofenadine is the active metabolite of terfenadine. So this is all about the second generation H1 receptor under the class, you can say the class A. Now we have to go through the class B under the same second generation H1 receptor antagonist, and in this only you put levo before cetirizine, so levocetirizine, and remove the des, then it now come the loratadine. So true drug levocetirizine and loratadine, and both the drug are very important drug. In these two, levocetirizine is one of the most usable drug as an anti-allergic drug, and it belongs to group piperazine. And because you are putting levocetirizine, so this is a enantiomer of cetirizine. So levocetirizine is cetirizine enantiomer. Other important point that are also very important is more potent. And when you are going to compare with the cetirizine, you will find Levocetirizine require half of the dose of cetirizine, and therefore it is going to produce less sedation than the cetirizine. So therefore this levocetirizine is more better than the cetirizine as compared to the dosage as well as its the sedative, if less sedative effect. Loratadine belongs to piperidine group, and the last one under the first second generation H1 receptor blocker or antagonist. The example are very interesting drug are mast cell stabilizer. So as we earlier told that if there this histamine is very much present in the mast cell, where it is synthesized here, it get stored here in the granules, and if the cell get ruptured, histamine is going to be released. Histamine is going to be released. The best example is the attachment of the antigen with the antibody present on the mast cell receptor, and therefore it get burst and histamine is released, and therefore anaphylaxis it will cause. So mast cell stabilizer is going to inhibit the breaking of the mast cell to release the histamine to produce the reaction like anaphylaxis. Under these two drugs are very important and most usable are agilastine and olopatadine. Olopatadine. So agilastine and olopatadine are very much usable drug as a mast cell stabilizer. So this is all about the H second generation H1 receptor blocker or H1 receptor antagonist or H1 receptor inverse agonist. Why we are calling it inverse agonist, that we are going to discuss this. Regarding the mechanism of action of this H1 or pharmacological action of H1 receptor antagonist is concerned, that we already discussed. The drug under the H1 receptor antagonist, H1 receptor blocker, they all are actually inverse agonists. So what is inverse agonist? Is going to produce action just opposite of the X agonist. So what the agonist is doing, that is going to produce physiological function by activating the receptor, whereas inverse agonist is just inhibiting the activation of the receptor, and you can so say the reduce constitutive activity, means ki histamine is going to attach and activate the GQ protein, and therefore it is going to produce its action through the DAG and IP3 pathway. Whereas the inverse agonist or H1 receptor blocker or antagonist not only occupy the position of histamine on the receptor, but also this is going to inhibit the activation of the GPCR GQ protein, and therefore that is going to act as a therapeutic agent. And this is about the pharmacological property of H1 receptor blocker or antagonist. Regarding mechanism that we already discussed, now we have to go through the pharmacokinetic of the H1 receptor blocker. And the pharmacokinetic means it is about the absorption, distribution, metabolism, and excretion of the drug. And thus, the drug that belongs to H1 receptor antagonist, they all are absorbed well through GI tract or orally. Not only that, they are also activating or inducing the enzyme present in the liver that we are calling it the metabolizing enzyme, cytochrome P450. So H1 receptor antagonist is not only antagonizing the action of histamine on the receptor, but also it induces the histamine, and there induces the cytochrome P450 and facilitate their own metabolism. So this is very important. Regarding the second generation H1 receptor antagonist is concerned, they are also get metabolized in liver by cytochrome, and some of the drug they form active metabolites of the second generation H1 receptor antagonist. The drug are loratadine, means get metabolized and form active metabolite, terfenadine that we already discussed, fexofenadine that is active metabolite, and estemizole. So this is all about the pharmacokinetic of the H1 receptor blocker or antagonist. Now we have to go through the last point about the therapeutic use of clinical use of H1 receptor blocker or antagonist, and this is very important. We already discussed about this, but again we are going to discuss about the therapeutic use of H1 receptor antagonist or blocker. The physiological function that histamine is going to produce, that is blocked by this receptor blocker, and therefore used for the same purposes, like this histamine is producing hypersensitivity reaction and anaphylaxis. So we are going to use for a treatment of anaphylaxis as a receptor H1 receptor blocker. This is also, histamine is also going to produce the motion sickness, may or may not produce vertigo and sedation. So the vertigo, motion sickness and sedation is also going to be treated by H1 receptor blocker or H1 receptor antagonist that we already discussed, that the cyclizine and meclizine, and most important is promethazine, is more potent anti-emetic effect, so in emesis caused by the motion sickness. So these drugs that we have mentioned, cyclizine, meclizine and promethazine, these three are used for the motion sickness producing emesis, vertigo and sedation. In addition to the other effects that are very important are for allergic reaction. So when there is allergic reaction is occurring, we are using this drug is very much in use as a H1 receptor blocker antagonist or inverse agonist that is going to inhibit the allergic reaction. These allergic reactions are rhinitis, urticaria, conjunctivitis, and also going to use to some extent in the bronchial asthma, because as we discussed, the histamine is going to produce the bronchoconstriction and anaphylaxis that we already discussed. So these all about the therapeutic utility of the H1 receptor blocker or antagonist. Now we have to go through the last point under the H1 receptor blocker antagonist or inverse agonist are its adverse effect that we already discussed, but again we are going to discuss it. This is going to produce the sedation, particularly the first generation H1 receptor blocker. In addition to that, when we are going to use H1 receptor antagonist along with the alcohol, along with the CNS depression, they are going to produce the addictive effect and it impair the motor skill. Addictive effect means when you are taking the H1 receptor antagonist along with alcohol, the this alcohol itself somewhat sedative. This H1 receptor antagonist, its first generation is itself sedative. They come together and produce addictive effect. Likewise, CNS depressant. Now, the other untoward effects are like dizziness, tinnitus, lassitude, incoordination, and so on. So this is all about the first, that is the H1 receptor antagonist, whether first generation or second generation. Now we have to go through the H2 receptor blocker that we already discussed about the H2 receptor blocker, that on the parietal cell, on the parietal cell, there is a H2 receptor is there, and this histamine is going to attach with the H2 receptor, and therefore histamine get raised intracellularly, and this histamine raised is going to act on the another pump or enzyme. We are calling it the proton pump, and hydrogen ion, potassium ion, ATPase, and therefore what will happen, this is going to release the hydrogen ion, and that hydrogen ion is going to combine with the chloride to form the HCl. So this HCl get raised. So this H2 receptor blocker is going to occupy this receptor. Therefore, no place for the histamine to attach with the H2 receptor, and therefore the action of this not histamine, this is cyclic MP. It is going to rise the cyclic MP, and this cyclic MP is going to have the positive effect. This is not histamine, this is cyclic MP, and this is having the positive effect on this enzyme. This is having the induction activity or the positive effect on the proton pump. So this activity is going to be inhibited by the H2 receptor blocker by blocking the receptor. So once the receptor get blocked, the histamine is not going to get the receptor to produce its physiological role to produce HCl. So it is act as a antacid. So it is acting through the activation of GS protein that we already discussed. This is through the GS protein that we already discussed earlier, and this is production of cyclic MP, and cyclic MP is acting on the proton pump, or you can say the hydrogen ion, potassium ion, ATPase, and that it secretes the hydrogen ion, and in exchange with the potassium ion that we already structurally demonstrated. So there is no need to explain the same thing. Under this, the drug are mainly four, and nowadays we are not using this four drug. Why? Because more better efficacious drug came that particularly inhibit this proton pump, and the drug are called proton pump inhibitor, PPI, proton pump inhibitor. So better option is there, and when we are inhibiting this proton pump directly, or drug are going to inhibit directly blocking this pump, then the HCl is not going to be released, and their efficacy is about inhibit 95% acid production, whereas the drug that are H2 receptor blocker, the examples are cimetidine, famotidine, nizatidine, and ranitidine. Earlier, these four are too much in use when this group PPI was not introduced, and this one is too much in use as an antacid or treatment for the ulcer. So the drug cimetidine as a H2 receptor blocker is not only going to block this, but also it inhibits the liver metabolizing enzyme, that is cytochrome P450, particularly cytochrome A1A2, cytochrome 2C9, cytochrome 2D6, and therefore this is going to produce the drug-drug interaction. Regarding drug-drug interaction is concerned, we already discussed about this in previous class. However, under the all four H2 receptor antagonist or blocker like Sami, like Femo, like Nija, and like ranitidine. The nijatidine and ranitidine both are also stimulating the GI motility. They also increase the GI motility. An important feature of this all the four drug is that these all four drug are OTC drug, over the counter drug. So what are the over the counter drug means? It means those drugs that are even available without the prescription. For this drug, you can't need the prescription. Regarding mechanism is concerned, that we already discussed, this is going to check the activity of histamine to act on the H2 receptor to produce acid, and it is reversible. Whosoever is acquiring higher concentration, their action is produced. I mean, if the histamine level is high, histamine is going to produce acid production. If the concentration of the drug as a H2 receptor blocker is high, this is going to block the action of histamine on the H2 receptor. So this is very, very important. So where this H2 receptor is actually present, this present on basolateral membrane of the parietal membrane, basolateral membrane of the parietal cells. So this, if efficacy is concerned, this group, under this group, the all four drug are coming: cimetidine, nizatidine, ranitidine, famotidine. They are inhibiting about 70% of the acid production, particularly the acid produced at night. So you can say nocturnal acid secretion drug is going to inhibit, or it inhibit, you can say, the basal acid production. That means ki if the acid is checked, that means ki acid is going to check. So this is called, the drug is for the anti-acid. So now we have to go through the therapeutic use of H2 receptor blocker or antagonist. So this drug are used as a anti-acid and used for the ulcer, either in the duodenum or either in the stomach. That is, you can say, this is the gastroesophageal reflux disease that is going to be checked by this drug. So ulcer is going to be treated by the H2 receptor blocker. But nowadays we are having the more safer, more better drug, that is the PPI, proton pump inhibitor. So we have to use nowadays this drug. So here is the point: less effective than the proton pump inhibitor, suppressing the acid process. So this is very, very important. Regarding the adverse effect is concerned, the idea: headache, drowsiness, fatigue, muscular pain, and constipation is coming. So this is very, very important. Now we have to go through the H3 and H4 receptor blocker. This blocker, I mean H3 and H4 receptor blocker, are less exposed and is still in experimental stage, and you can say they are not in used. Even though the drug that are coming under this H3 and H1 receptor antagonist, they may be having the potential for the treatment of sleeping disorder, ADHD, epilepsy, cognitive impairment, schizophrenia, obesity, neuropathic pain, Alzheimer's disease. So this is very, very important to explore this group. And for your kind information, what is the full form of ADHD? This means attention deficit hyperactivity disorder. What is the cognitive impairment? This is the trouble in remembering. Schizophrenia is nothing. This is the problem with the thinking. So this is all the disease is concerned to the neurons or CNS, and therefore, because this receptor is especially, particularly H3 receptor is present in the CNA, so this is very much a unexplored area to be explored to use the H3. In this, the drug that we are using as a H3 receptor antagonist is thiopyramide. Thiopyramide is a first specific H3 receptor antagonist and also inverse agonist, and only available experimentally, so that we already discussed. And this is not only the H3 receptor antagonist, but also the H4 receptor antagonist. The other imidazole derivative as a H3 receptor antagonist are clobenpropit, ciproxifan, and proxy fan. So this is all about this class. In the next class, we have to discuss the next thing. That's all.